of Family, Seniors, and Health. Mr. Secretary, please call the roll.
Senator Carter.
Here.
Senator Bratton.
Here.
Senator Lewis.
Here.
Senator Hudson.
Here.
Senator Nicola.
Okay. Will you check outside and see how many? Our plan is to end at 11:45, so we want to make sure that we have opportunity for everyone to give testimony. So we're just going to see how many people are here in favor and how many are here in opposition, and then we will try to time our committee hearing accordingly. So he'll check outside to see how many on either side we have, and we'll move from there. Okay. Okay. All right, so we're going to start with those in favor. We're going to limit testimony to 2 minutes, and we'll watch the time, and hopefully we'll be able to get through everybody within that 2-minute time frame so that we don't have to decrease the testimony time just in order to get done by 11:45. A couple of reminders, housekeeping reminders. Please be respectful of each other as we have these conversations. We want to give equal time to proponents and opposition. So testimony, again, being limited to 2 minutes to begin. Hopefully we won't have to decrease that. And the committee will accept written testimony from anyone that is present but is unable to testify due to time constraints. So if that testimony is written down and we don't get through, please submit your testimony, leave it here on the table, and we'll make sure that that's distributed to the rest of the committee. So with that, Representative, you may begin when you're ready.
Thank you, Madam Chair. Committee members, I present to you HJR 73. The preeminent facet of this legislation is that it protects women. What Amendment 3 took away from them, this legislation seeks to restore. It will also help foster a culture of life in Missouri, one that all citizens can support. It is the state's duty to protect public health and welfare, including protecting the integrity and ethics of the medical profession. This legislation helps return providers to a position of emphasizing patient care, including sufficient exams and licensure. HJR 73 will eventually go to a vote of the people, and because the voters expressed that they wanted exceptions, HJR 73 provides those. It also declares that the General Assembly may enact laws that ensure the health and welfare of pregnant mothers. This legislation will ensure that facilities where abortions are performed are inspected to be clean, the conditions are safe for women, and adequate instruments are available to treat any emergencies arising from an abortive procedure. This legislation protects women and seeks to align itself with the will of the voter. This is not government by edict, but allows voters to decide what type of state they'd like to live in when it's put on the ballot. With Amendment 3, voters were presented with a false dichotomy. Advertising went along these lines: pass Amendment 3 or women will die in our hospitals. Voters were told that women could not get care for ectopic pregnancies or miscarriages. These commercialized statements were blatantly false. This legislation presented today ensures via our Constitution that a woman's access to health care in cases of miscarriage, ectopic pregnancies, and other medical emergencies shall not be infringed upon by the state. This legislation protects women. Because of Amendment 3's ambiguous language as to whether or not it legalized transgender surgeries on children under a loose interpretation of reproductive health care, Abortion Action Missouri, formerly NARAL, posted on social media that the new right to reproductive freedom did include gender-affirming care. This is a leftist interpretation. It's not mine. The leftist National Women's Law Center also states that gender-affirming care is included in reproductive health care. HJR 73, on the other hand, says that no gender transition surgeries shall be knowingly performed on children under 18 years of age. This legislation shall not apply to surgeries, drugs, or hormones to treat children born with medically verifiable disorders of sex development or treat other issues unrelated to the purpose of gender transitions. Let our children grow into adulthood where they can make decisions for themselves, having the cognitive ability to do so. This legislation protects kids. Lastly, and probably the most important concern to those who voted for Amendment 3 is that this legislation allows for abortions to be performed or induced in case of medical emergency, fetal anomaly, rape, or incest. It's my contention that this is what many voters who voted for Amendment 3 were concerned about. Missourians did not vote for abortion on demand at 9 months or past the age of fetal viability. This legislation will protect many infants in the womb and see a renewed focus on the sanctity of life, envisioning a culture of life in Missouri. Let me be perfectly clear. Life begins at conception. As I said in committee, this can be proven scientifically, scripturally, and is an intuitive understanding of all human beings. We know this instinctively because it's true. Even our state constitution declares that life begins at conception. The voters understand this and will support it when they vote. But because we seek to understand the will of many voters and present legislation that more accurately represents the will of the voter, abortions in this HJR may be performed or induced in case of rape or incest no later than 12 weeks gestational age of the unborn child. For those who believe, as I do, that life begins at conception, I ask they consider what voting for this legislation means. HJR 73 provides for protections for women's health, it protects children, and it protects possibly tens of thousands of infants in the womb. This is pro-life legislation that can and will pass muster with the Missouri voter because it allows for the exceptions that they may have voted for prior. Amendment 3 simply went too far and harms women. This legislation has the support of many pro-life organizations, including Missouri Right to Life. It's been well vetted and allows the people, not government, to decide. Missourians deserve to be presented with better options at the ballot box, options that are more in line with their values and that aren't marketed to them in a deceptive manner. Missourians believe in a culture of life. HJR 73 is not about perfection. It's about doing what we can to present voters with a viable option that isn't hidden behind slick marketing campaigns, money paid for or commercials paid for with money from God knows where. HJR seeks to protect women, children, and innocent life. I'll now take any questions if the chair allows.
Thank you, Representative. Any questions for the witness? Go ahead.
Thank you, Madam Chairwoman. Good morning, Representative.
Good morning, Senator. How are you?
Doing Okay, so let's jump into a couple other things. I want to keep my questions super limited.
Sure.
Obviously, Missourians have traveled from across the state to be here. Unfortunately, they weren't able to make their voice heard during the House Committee hearing process of that, or very few were. So I really want to respect their time and dedication to this issue. When we talk about, we don't know where, money from God knows where, I know there's a lot of folks here that helped with that effort, and I was certainly one of them. But I know they will speak to that. Let's talk about the so-called exceptions for
Yes.
rape and incest. When we talk about these so-called exceptions, are you aware that sexual violence is one of the most underreported crimes?
Sexual violence is a horrific crime and should always be reported.
Are you aware that it is one of the most underrated crimes, Representative?
That may be. I'm not certain of
Okay,
that.
so it is. All data will suggest, right? Not just suggest. All data is very clear. It is the most underreported crime, Senator. So
That's terrible.
When we talk about sexual violence, it's clear that it's very difficult for victims to come forward. They often delay reporting or don't report at all. And I am very curious how we came up with this arbitrary number of 12 weeks. Why did you decide, or why did the author of this decide that they were qualified to pick this arbitrary number of 12 weeks to impose survivors of sexual violence, a heinous crime as you have said,
Right.
who have decided they don't want to be forced to carry a pregnancy that resulted because of that crime? How did you decide 12 weeks?
Right. I think 12 weeks is during the first trimester. And I think the crime of rape and or incest is just, it's horrific beyond imagining, and I cannot do that. But we do allow for those exceptions, and that's what I think the Missouri voter voted for if they voted for Amendment 3. Those exceptions of rape and incest, and 12 weeks is during the first trimester.
But Representative, you are forcing that survivor to come forward very early. And again, I've just said that it's one of the most underreported crimes that they're ever able to come forward. And now we're saying, hey, you have to do all of this, go through all of this trauma again by 12 weeks?
No, I think already in state statute, we have declarations that if someone was a victim, that they would be allowed recourse in the courts and so forth. And I don't think 12 weeks is arbitrary because we're talking about a third person.
Okay.
Is
We'll
that
certainly
individual
have
worthy of
physicians
life?
that can speak to that a little bit. I'm not a physician. I know you aren't either. But this is one of my biggest frustrations with how this is being pitched, if you will. The slick marketing behind your side right now on this, right? That we're going to carve these out with so-called exceptions, and I don't think they are exceptions, Senator or Representative. I really don't. When we talk about this, I mean, it has been clear time and time again. I encourage you, I implore you to look up that data and research and understand, try to have some empathy with those survivors of sexual assault and the stories that they're going to be sharing coming forward today. Thank you.
Any other questions for the representative? Just one. In some previous version of this conversation, there was some language relevant to sexual crimes and assault and them being reported. And,
Sure.
and if I remember right, that was rejected.
Correct.
Okay.
This legislation does not carry the reporting requirement because that is already in state statute. If a crime has been committed, that physicians and anyone with knowledge of that crime would of a necessity report it. So I think it would be redundant.
Want to, for the benefit
Sure.
of the committee and for those listening, that there was talk of trying to help, women be able to report those crimes and make a clear path, but that reporting was
been
rejected.
removed. Yes.
Yeah. Okay, thank you. Any other questions? Seeing none, thank you for your time. First witness testifying in favor. Remember, 2 minutes, please, or less.
Good morning. My name is Timothy Faber, and I do believe that this is a great piece of legislation. It allows the people of Missouri an opportunity to vote on the matter with the issue being presented to them more clearly and accurately than was previously done. I do particularly like Section 36, Paragraph 3, which is line 10 at the top, page 2. That says the General Assembly may enact laws that regulate the provisions of abortions, abortion facilities, and abortion providers to ensure the health and safety of the pregnant mother. In a constitutional republic, the people elect a body of fellow citizens to carefully consider and deliberate the details of each issue. The people may decide the big picture, but the details are too cumbersome for the entire citizenry to deal with. That is why you are here. This bill restores to the legislature what should never have been stripped away from you in the current Section 36 of the state constitution. I would also say that probably at some point during this morning, someone's going to bring up Adam and say that life begins at first breath because Adam was not alive until God breathed into his nostrils the breath of life. But what they fail to mention is that Adam was not born of a woman. Adam never experienced the gestational stage of his life. He was created as an adult. And other than him and Eve, every other person has been conceived in a woman's womb. And that conception is, in fact, the beginning of life. Thank you.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony. Thank you. Next in favor. I just want to offer up the suggestion also, if you, when you're done testifying, if you would exit the room so that that gives opportunities for others that are waiting out in the hall to come in and have a seat, we'd appreciate it. So begin when you're ready.
Thank you, Madam Chair, members of the committee. For the record, Susan Klein, representing Missouri Right to Life, here to go on record in support of House Committee Sub HJR73, and we thank sponsor Representative Seitz and the Senate sponsor as well. You know, when Amendment 3 was being circulated, women in Missouri, as well as the citizens, were told that women would be at risk if Amendment 3 didn't pass. Well, now we know that Amendment 3 is passed, but we also know that women are more at risk today than they were prior to Amendment 3. And why is that? Because the day after Amendment 3 passed, Planned Parenthood and the ACLU filed a suit to take out of our laws protection for women. They stripped out via the court that doctors have to perform abortions. That's gone. Sterilization standards for surgery instruments and equipment and standards to follow is gone. Having emergency equipment on site is gone. Having emergency drugs, oxygen, and fluids in a surgical room is gone. That ultrasounds be performed by a doctor or a medical technician is gone. That an abortion provider perform an exam to identify possible complications that could occur based on a woman's medical condition is gone. Why did they go after the health and safety standards first and foremost? And as late as Monday in a Boone County court, Planned Parenthood argued in support of protecting a person that would assist a minor without parental consent to go across state lines or to get an abortion, period. So all of these, why are these health and safety standards necessary? Because Missouri Planned Parenthoods have a history of altercations that have found by our health department, such as they showed that they had rusty equipment. They were using it. Had there not been an inspection, we would not have known that. They had dried blood on equipment, and they were unqualified personnel and expired drugs. So Missourians deserve another chance to vote.
Thank you for your testimony. Any questions for the witness? Senator Bratton?
Could you, I know you have a little bit more, could you kind of finish of what you're explaining in terms of the women's health? Because that's one thing I think we've got to express, is because we're going to continue to hear that, oh, this is an attack on women, when, you know, if somebody currently under the Constitution is harmed in an abortion clinic, can they seek remedy? Can they be criminally charged if they were absolutely egregious in the way they performed these sorts of abortions? I mean, these things need to be answered, and people need to know that. So could you kind of expound on that a little bit?
Right. And with Amendment 3, someone who harms a woman cannot be prosecuted. That was even argued by Planned Parenthood in the court on Monday. dealing with parental consent, that they called it an assister. Anybody who assists a woman or a minor getting an abortion cannot be prosecuted. And that was their argument. Now, the judge did dismiss that, but that is there. And we're going to have to deal with that until we get Amendment 3 out of our Constitution. So women's lives are at risk right now with Amendment 3, and there's no recourse for them. So it's important for HJR 73 to pass and take Amendment 3 out of our Constitution, replace it with this good language that the representative has presented to you.
You know, I've had numerous conversations with people, even especially with those who supported Amendment 3, and when you actually show them what was in Amendment 3, they're almost in disbelief that was not in there. That's not what I voted on. So it is abundantly clear that there were so many things hidden underneath the actual amendment of what went into the Constitution versus what people really knew what they were voting on. Because they only had 100 words in which to decide whether or not this was supposed to be the law of the land and enshrined in our Constitution. So I know we'll hear that, we knew exactly what we were. It's been abundantly clear by my own conversations with people, they didn't know that these measures like this, that if an abortionist perforates someone's uterus and they're bleeding out and you try to seek remedy and they knowingly harmed you, that you can't even there's no recourse whatsoever under the law under this amendment, and they're flabbergasted by knowing that. And that alone, I think, it should be thrown out for the fact that was not advertised in what people voted on.
We've even had people who support abortion call Missouri Right to Life and say, we support abortion, but we didn't realize that we were voting for abortion all 9 months of pregnancy. And so they're concerned. They want another opportunity to vote. And now that we've seen the effects of Amendment 3, I think people should have the right to vote because they know now exactly what they voted on, which is abortion all 9 months of pregnancy and no protection for women.
Well, and to say that we're undermining the vote of the people, well, it goes back to the vote of the people for them to decide whether or not to overturn what they had, the bill of goods that they had been sold, unfortunately. So thank you for your testimony.
Any other questions for the witness? Senator Lewis?
Thank you. Good morning. Thank you for being here.
Good morning, Senator.
I'm just having a hard time trying to wrap my head around voters didn't know what they were voting on. We've got five witnesses here in this hearing room that support the bill, and we have, maybe 100 or so in opposition that have traveled with less than 24 hours notice. They're packed in the hallways ready to testify. So help me understand that, the hundreds of people that didn't know what they were voting for. But in reality, we have 5 witnesses in support of this bill in a packed hearing room and packed hallway in opposition.
Missouri Right to Life represents hundreds of thousands of people across the state of Missouri.
Where are they? Thank you.
Any other questions for the witness? I have just a couple comments. Section 1.205 says that that life of each human being begins at conception. I think, just again for the benefit of the body and those listening at home, this was passed by a supermajority of Democrats in 1980. So it's just interesting, where we are today in our culture. I appreciate your time coming forward. Also, just want to say that I think that there is confidence with a supermajority of Republicans at the helm that those people who are pro-life at home know that the representatives and senators in this building are going to do the right thing and bring this back to a vote of the people. So I think it's their confidence in us in moving this forward that has alleviated the concern for them to have to come and be here today. So I appreciate your time and being here. Thank you.
I agree with you.
All right, next in favor.
I felt like it was a good time to follow up behind Susan because she made some very good points. My name's Amy DeClue. I'm from Franklin County, Missouri. I am a surgical nurse. I've been a nurse for 18 years now.
I don't mean to cut you off. I just want to make sure that everybody can hear you well. So just make sure the microphone is.
Okay, sorry.
There we go. That's much better. Thank you.
I am a surgical nurse. I've been a nurse for 18 years. I've been a surgical nurse for the last 5. I remember when people brought up the lie that after Roe was overturned by Dobbs, that we weren't going to be able to do ectopic or miscarriage care, which is a lie. I continued to provide ectopic and miscarriage care to my patients, even post-Dobbs. I ended up actually finding my Facebook post that I made June 27th of 2022, stating that please don't sit out in our parking lots and think we're not going to care for you. Please come inside. We will still care for you. We still do these things. So unfortunately, it was such a problem in our area that people thought, because of misinformation being spread, that women were not going to get care unless Amendment 3 passed, and that was completely false. I've actually cared for women post-abortion. One in particular I'll never forget, because when she showed up, you could tell she was just mentally drained. She was alone, she was afraid, and she was just very sad because this post-abortion, she couldn't quit bleeding, and they had left products of conception in her, and we had to care for her, take her back there, and remove the products of conception that had been left behind. I had another woman that I cared for that after a few abortions she had in her 20s, she was now trying to get pregnant in her 30s with her partner and could not because of all the scarring that she had post the abortions from her 20s. And I'll never forget her and her fiance sitting in my PACU and just sobbing because she'll never be able to have children now. When we do DNCs at the hospital, it's very important to have a physician there, anesthetists and nurses, because as Senator Bratton said, there is a high risk of perforating the uterus. And when you do that, the uterus is very vascular, and you have to watch for bleeding. And if they are in places like Planned Parenthood who are not watching for that, a woman could easily bleed to death, especially if she does not seek attention quickly.
5 more seconds.
Okay. So as a surgical nurse, I am 100% for HJR 73. I feel like Amendment 3 stripped the rights to protect women.
Thank you for your testimony. Any questions for this witness? Senator Bratton.
So just to follow up, so I know during the campaign of Amendment 3, what was out there and what the main target and main focus of the proponents of Amendment 3 was that women can't receive care. And I remember the ad of a woman on an operating table literally dying and saying that because of Missouri, these arduous laws, pro-life laws, that women can't receive care. Was that a lie?
That was a complete falsehood.
So the voters were sold a bill of goods that women were dying because of Missouri law, but you could absolutely, as a medical professional, treat women with these sorts of conditions, correct?
And even sadder, we had physicians in bigger cities step up and say, well, I don't know, I'm going to get in trouble if I perform these. That's false. If they don't know their scope of practice, they shouldn't be practicing. The OBGYNs I worked with had no problem doing ectopic care and DNCs on women who had missed abortions.
Well, I mean, I had to read the actual, and I would even post it on social media, like people making that claim that they're dying, and it explicitly spells out in Missouri law, what was law at the time, that these sorts of carve-outs were in law. So I agree with you that any medical professional that was refusing to treat should have lost their license, because they need to, if they don't know, then they have no business practicing medicine and treating individuals if they're not willing to render aid when they're fully capable under the guise of the law. So
Correct.
I appreciate your testimony and the clarification that I know we're going to hear from the opposition that this is a step too far, but we had it right, and this I think alleviates a lot of the concern that a lot of people said, and we're going to belt and suspenders this the argument I think that was always made by the Amendment 3 folks. So thank you very much.
Thank you.
Thank you. Any other questions for the witness? All right, seeing none, appreciate your testimony. Make sure you leave a witness form on the table. Next in favor? 2 minutes. When he starts, yeah.
Thank you. I'm Byron Keelan, president of the Freedom Principle Missouri. And then on November 5th, 2024, Missouri voters narrowly approved Amendment 3 under the pretense of protecting women. This Trojan horse ballot initiative radically changed Missouri's constitution, putting women and children and men at serious risk. Today, all Missourians have lost any legal remedy for malpractice. Also gone are fair medical licensing standards related to any facility that performs reproductive-related care, including simply prescribing birth control or performing vasectomies. All abortions can currently be performed in Missouri, including partial birth abortions and abortions on demand all 9 months of pregnancy, despite Missouri voters speaking out repeatedly and decisively against the horrible, grisly procedures that put Missouri's women at risk. HJR 73 clearly defines reproductive health care and abortion, gender transition procedures, and, as agreed to by the overwhelming majority of voters, rather than the corrupt, out-of-state extremists who upended our rights last fall with Amendment 3. It also returns vital protection against malpractice and injury for all Missourians. These changes are not just important, they are critical to protecting Missourians. This will restore ethical medical standards and protect Missourians' most vulnerable citizens rather than shielding insurance companies, abortion providers, and medical systems from liability. Thank you.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none. Thank you. All right. Next in
Thank you,
favor.
Madam Chair, members of the committee. Samuel Lee with Campaign Life Missouri to go on record in support of HJR 73. And just as a reminder, this is very similar to SJR 33, which you have already voted out of this committee. And so very grateful for that. And we're grateful that you're giving the voters another chance to vote on what they really want to be in our Constitution. Because they were lied to. They were lied to by omission. And the lawsuit by Planned Parenthood, just hours after Amendment 3 was approved, proves that. Nowhere during the campaign did supporters of Amendment 3 tell the voters that if your daughter is pregnant, she can have an abortion without your knowledge, without your consent, and not even an abortion performed by a physician. And yet that is what Planned Parenthood's lawsuit claims Amendment 3 does. It claims that that abortions can be performed by people other than physicians. It can be performed on girls without their parents knowing about it. Just imagine as a parent finding out that the first time finding out that your daughter had an abortion when you get a call from the emergency room that she's bleeding to death because of a botched abortion performed by a non-physician because of Amendment 3. So thank you. Thank you for giving the voters a chance to vote on what they really want and not this false law that was approved by the voters last November because they were lied to, and lied to with $4.6 million in foreign funds that were used to support Amendment 3. Thank you for pursuing the legislation to prohibit in the future any foreign funding of ballot measures. I hope that gets across the finish line this year. It really needs to pass so that when this is being voted on in November of 2026, we don't have outsiders trying to tell Missouri what to do. Thank you, Madam Chair.
Thank you. Just a quick question. Do you think that this language in Amendment 3 exasperates the reporting concerns that have been expressed in the committee? I mean, if a parent doesn't even know that their child is getting an abortion, do you think that exasperates that concerns? Or
What the Amendment 3 does, HJR 73 fixes that problem. Okay, for sure on parental consent, but all sorts of things.
But where we are currently, if we don't amend it or change it.
Absolutely. And again, that was part of Planned Parenthood's lawsuit. So we don't even have some basic data being reported anymore about abortions that are being performed because a rogue judge in Jackson County has struck that down. Thank goodness we have a pro-life attorney general who's looking out for the women of Missouri who's appealed that.
So we have a situation where there is a concern about sexual assault being the number one underreported assault on women,
right,
essentially. And you, in your opinion, you're agreeing that Amendment 3 language has exasperated that concern.
Absolutely.
Okay,
as a reminder, the 93% of all abortions are performed in the first trimester of pregnancy. So we're talking about even with this proposal here, a week after. This says 12 weeks gestation. That's 14 weeks of pregnancy. That's a week after the first trimester. So 93% of all of abortions plus abortions would be allowed under this provision. But it's also giving an incentive for those who know that a woman or a girl has been sexually assaulted to get her to a rape crisis center, to get her to a counselor, to get her to a physician or a nurse early enough in pregnancy so she can make the decision that she needs to make.
And it seems like you'd want to act swiftly.
Absolutely.
Not delay it,
Why
right?
would you want to have repetitive sexual assaults without that being reported?
Right.
So this proposal empowers those to help those women who are being sexually assaulted.
Okay, thank you. Any questions for Senator Hudson?
Thank you, Madam Chair. Thank you for being here, sir. Thank you for your testimony. You brought something up in your statement that is something I've been hearing about, not just post the election, that Amendment 3, where Amendment 3 was on the ballot, but also during the campaign. Individuals had concerns about foreign funding of the ballot initiative. I was wondering, could you expound on that a little bit?
Sure. There's an organization called the 1630 Fund. It's based in the Washington, D.C. area. And they pumped a lot of money into Missouri on Amendment 3. Also, by the way, on Proposition A, which I know that you're debating in the legislature right now. The final number after the election was $4.6 million was from that organization. A lot of their money comes from a Swiss billionaire who is funding all sorts of ballot campaigns in states, progressive, liberal, whatever way you want to call them, throughout the states. That needs to stop. If you took $1 from a foreign country for your campaign, that's unlawful right now. Mm-hmm. It should be unlawful for Planned Parenthood or for any organization to take a dollar from any foreign country, foreign government, or foreign individual on our ballot measures. Because it's unfair to Missourians to have money from outside the country trying to influence their vote.
I totally agree with you. Did you say $4.6 million tied to foreign influence on this ballot measure?
Right.
Yeah.
Yep.
And that was one of the concerns I heard, and also, and I won't spend too much time on this because it's already been mentioned, but the marketing for this amendment trying to indicate that individuals couldn't get the health care that they needed unless this particular Amendment 3 was passed, when anyone who knows Missouri law knows that just wasn't the case.
That's not true. And just ask any Catholic hospital in Missouri, which of course they don't do abortions except if the life of the mother is at risk. And they have continued before and after Amendment 3. There's been no change. Miscarriage care, ectopic pregnancy care, all sorts of reproductive health care other than abortions, they have performed and provided to their patients. And so Amendment 3 was never necessary for them to do their job.
Right. Absolutely. Thank you, sir. Thank you for testimony.
Any other questions for the witness? Senator Lewis?
Not for the witness, but just to reemphasize the room. I think you had said, like, once you testify, you're not going to allow for others. And I see some witnesses, they're still in the room, so just wanted to.
Appreciate that. Okay, any other questions for the witness? Seeing none, appreciate that.
Thank you, Madam Chair.
Thank you. Next in favor? Last call for anybody in favor. Will you check the hall, please?
Thank you, committee, and good morning. My name is Kurt Wickmer, and I represent the Missouri Catholic Conference in favor. The Missouri Catholic Conference appreciates effort like this here. We support a comprehensive culture of life in Missouri, and so we appreciate efforts that protect the life and well-being of both the child and the mother involved. So for that, we support, and I open myself up for question.
All right, thank you. Any questions for the witness? Seeing none, appreciate your testimony. Make sure you fill out a witness form, and please exit the room when you're finished to allow more seating. All right, next in favor? Is that it?
I believe so, yes.
Okay.
Anybody else for
Okay, great. That concludes the hearing or the testimony in favor. We will now move to those here to testify in opposition. Just a few more ground rules to cover those again. Please limit your testimony to 2 minutes or less, and we appreciate your time. Come on up. Make sure your witness form is filled out on the table, left on the table.
Thank you, everyone, for your time. My name is Christine Jackson. I am an OBGYN physician in St. Louis, Missouri. I am a 7th-generation Missourian, and I'm an abortion provider. I come to you today on behalf of the patients I serve and ask you to vote no on HJR 73. In medicine, we are taught to listen to and believe in what our patients tell us. Let me tell you about one of my patients. We can call her Sarah. She's a young mother who was admitted to our ICU for a complication of her diabetes. On her admission to the hospital, she found out she was pregnant. When I met her, she was grappling not only with her acute illness, but hundreds of questions. How long will I be in the hospital? Who will care for my son at home while my partner is at work? And then, if I'm so sick this early on in my pregnancy, what if it gets worse? What if it kills me? As we spoke about her fears and anxieties and hopes, she opted to terminate her pregnancy so she would have the best chance at being alive and healthy for her son. However, despite knowing that her condition would likely worsen throughout the pregnancy, she did not meet criteria for a medical emergency and thus could not receive an abortion in the state of Missouri at the time. She was at the same time too sick for a procedure at a local outpatient facility even after she was stable for discharge. After coming to her with this news, her spirits falter. She asked me, "What do I do now?" So after she was stable for discharge, this person, this mother, this Missourian, was forced to travel 250 miles to Chicago to receive her care in an Illinois hospital. She traveled 5 hours away from her child, away from her partner, away from her home to receive care that we could have safely provided down the hall, but was illegal at the time. I am asking you to believe the nearly 52% of voters in the state of Missouri who voted for abortion to be legal in the state. I'm asking you to do the job that the people of Missouri elected you to do, to listen to them and to believe them when they say they know what they voted for. I'm asking you to believe the majority of people in Missouri who have demanded access to reproductive health care. I'm asking you to stop this bill and let me care for my patients. Thank you, and I'll answer any questions.
Any questions for the witness? Go ahead, Senator Lewis. Or, sorry, Nuremberg.
Thank you, Doctor, for being here. Very quickly, does Amendment 3 allow for medically necessary restrictions?
Sorry, it does allow for...
Did it allow for medically necessary restrictions?
It enabled us to provide care when it was medically necessary.
Okay.
Okay.
That's yes, thank you for rephrasing that. Specifically, paragraph 4 states the General Assembly may enact laws that regulate the provisions of abortion after fetal viability. Was that your understanding as well of Amendment 3?
Yes.
Okay. So somehow, over and over again, we keep hearing this lie repeated that this is abortion on demand until 9 months, and that is simply not true. Is that your understanding as well, Doctor?
That's my understanding as well, yes.
Thank you. Appreciate your testimony.
Any other questions for the witness? Senator Bratton?
So with Amendment 3, it absolves liability for you as a practitioner. I mean, do you think that that's what people voted on and wanted? So if you accidentally harm someone, it absolves you from any sort of liability. Do you think that's what people actually voted for, and they knew that they were supporting that sort of measure?
As a physician, I am certified by the board, like the State Board of Missouri, for my licensure, and so I am obligated and desire to perform within the rules and stipulations of the State Board for my licensure. So, to my understanding, Amendment 3 does not impact that.
Well,
So-
of course it does. That's what the actual the lawsuit was, and it absolves, and it's clear in there that from criminal or civil prosecution. So, do you think that people actually knew that they were voting for that?
I think I can speak from my experience as the importance of Amendment 3 is to be able to provide safe and adequate
But
and
it's not
important
safe.
care.
So if you actually harm an individual by negligence, accident, because you're human, as we all are, we all make mistakes. We all in your world, unfortunately, people's lives are at risk if you do make a mistake. Do you think you should be held liable in any way? Do you think that the people, when they voted on this, realized that they were absolving you from liability?
I think it's hard to know, ask every single voter in Missouri. I actually
But
think
do
we
you think
did ask
a
every single
rational
voter in
person is
Missouri in
going
the
to
election.
absolve liability of an individual that may cause them harm in a procedure?
I practice within my scope of practice. I do everything to make sure the patients are safe and receiving safe and evidence-based care.
Because man, if I wanted if I had to have a heart surgery, I would want the most qualified individual. But I know if that person was negligent and caused me harm and almost killed me, that I would want to seek remedy against that individual that was negligent. But this amendment that passed absolves that capability of an individual, of a woman who would be harmed in these sorts of circumstances.
I can't speak to that, but I can speak to the harm
But
that
the lawsuit from Planned Parenthood that was overturned by the judge, whose name escapes me, who overturned these regulations for safety standards. So do you think that helps women?
Regarding the lawsuit, I will defer to other people who have.
Well, you're a
more-
physician. I mean, so if we're removing these protections that are a part of every other surgical center or hospital, we absolved it for abortion. Do you think they really knew that they were voting on that?
Abortions are safe. They are
Well,
safe procedures.
you say that, but I've seen several pictures of people calling an ambulance out of several Planned Parenthoods here in Missouri, of them being harmed and hemorrhaging and having to go to a hospital. So to say that 100% of that is blatantly false.
I did not say that 100% of that is
Well,
blatantly
to
false.
say it's
I'm
safe, that
saying
would mean that
abortions
there's
are
no
incredibly safe.
light
They are safer
capability
than
of
being-
harm.
They are safer than carrying a pregnancy to term. There is a risk of abortions, and we fully
So there is
counsel our
risk
patients.
of potential harm to the patient. So if there's that potential risk of harm, the people voted for something that would absolve that liability.
There's a potential risk of harm in any medical procedure.
So why would anybody in a rational mindset, whether you're for abortion or against, absolve that, if they knowingly absolve that?
I am here to talk about my experience as an abortion provider and what I see and care for patients. I'm happy to answer any of those questions. I
So
cannot speak
in your
to-
practice, has any provider ever made mistakes in terms of the care provided? Like, has anybody been harmed or even in a minuscule way under anything that you've supervised?
in any part of medicine, there is a risk of inadvertent mistakes or anything like that. There's always a risk, and that's why we fully counsel patients on possible risks. But overall, abortions are incredibly safe. They are one of the safest outpatient procedures. They're safer than tonsillectomies. They're safer
So do you
than wisdom
now
teeth removal.
do you now let your patients know that while there is a risk to you, there's no risk to me?
I can't speak to that.
Okay. All right. Thank you.
Any other questions for the witness? Senator Lewis?
Thank you. Good morning. Thank you for being here. So do you have medical malpractice?
Yes, I do.
Okay. It's my understanding that Amendment 3 has nothing to do with that. You're liable and you practice as a physician under the Board of Healing Arts.
Yes.
I have active license as a nurse here in the state of Missouri. I'm under the Board of Nursing. So this, let's just be clear, this has nothing to do with your malpractice. If you do, like they said, we're humans and we can make mistakes. I think you were talking about a tonsillectomy. In this committee, we've talked about like consent for certain procedures over and over and stuff, and we going, whether it's a tonsillectomy or any other healthcare procedure, you got to give consent, and you're saying, I understand the risk, and you as the physician is explaining to the patient. So does that happen in abortion care?
Absolutely.
Okay. And then as an OBGYN who performs abortion here in the state of Missouri, I'm looking at the ballot language here. And as we talk about Missourians, as some of my colleagues have said, Missourians were tricked with Amendment 3. I don't know if you've seen this bill or the ballot language, but it talks about, right here in the summary, let me see if I find it. Voters, shall the Missouri Constitution be amended to, and it says, protect children from gender transition. So what does an abortion have to do with gender transition?
It doesn't.
Okay. So to me, this sounds like this is a trick.
Yeah.
Okay, thank you.
I would agree with that, yes.
Senator Hudson?
Thank you, Madam Chair. Thank you for being here. Thank you for your testimony. I'm trying to recall some of the things you said in your opening remarks, and also, if I understood you correctly, you're a physician.
I am.
And you are an abortion provider.
I am.
I have a question for you. Have you been involved in assisting or helping a patient obtain an abortion by crossing state lines?
what does that have to do with this testimony today?
We're talking about Missouri law. We're talking
Correct.
about abortion. There's been much discussion about what Missouri law was before Amendment 3, what Missouri law is now, and what Missouri law could be should the Representatives HJR be added to the Constitution. And so I think the question is relevant.
Okay. I think that I can speak to my work as providing care for my patients under the Missouri state law. So I have not ever acted against Missouri state law, either before or after Amendment 3 was passed.
So are you saying you have never assisted an individual to go across state lines to get an abortion?
I provide care with under the guidance of Missouri state law.
In your capacity, have you assisted an individual to go across state lines to get an abortion?
I'm so sorry. I don't understand the relevancy of my being able to care for. I am here to speak on the risks of not being able to obtain abortions for the people in Missouri and how that has impacted my patients that I care for in the state of Missouri, and people who need abortions for medical complications that were not exempted in the law prior to Amendment 3. So I'm here to discuss how that impacts patients, how that impacts women, and how Amendment 3 will keep women safe.
So with respect, and maybe I can go about this a different way. If I remembered correctly, in your opening statement, you described an individual that needed and that you felt like needed an abortion, or that someone felt like they needed an abortion, and you said that individual went to another state to get that.
Yes.
Okay.
She went to, when I followed up with her, she had gone to, Chicago.
So so with that statement, I would make the argument that you yourself have indicated that discussions such as this are relevant. And if you're refusing to answer my question, I'm not saying that you're forced to answer my question, but the question is, have you assisted and helped someone get a referral or to get abortion across the state line?
I have spoken to them about their options.
Thank you. Thank you, Madam Chair.
Thank you. Thank you for your testimony. Make sure any other questions? Make sure you leave your witness form there on the table before you leave. I appreciate your time. Okay, next. In opposition. Remember, you have 2 minutes. It doesn't matter, either one.
Thank you. Hi, everybody.
I really want to make sure you have a witness form if you...
I didn't have it before now, but I will.
Thank you.
My name is Dr. Houston. I'm from St. Louis, and as a physician in obstetrics and gynecology, I use the knowledge that I've gained over 10 years of training to empower my patients to make informed choices about their health care. Abortion bans like the one proposed fracture these trusted relationships that I work very hard to build. When I'm not able to provide the full scope of care my patients need, they suffer delays in their care and they experience harm. The harm can be immediate, like increased risk of bleeding or infection, or longer term, like worsening of chronic health conditions, or increased risk of health problems like diabetes and high blood pressure. There are also the long-reaching mental harm of carrying the increased risk to one's life without the ability to choose medical care to reduce that risk. The language of this bill doesn't capture the nuance and complexity of each individual situation, and patients often are faced with unexpected diagnoses and circumstances in their pregnancies. They make thoughtful, compassionate, and sometimes hard decisions, and I'm here to advocate on behalf of my patients and in agreement with over half of the voters of Missouri to keep people's medical decisions between them and their doctor. Thank you. I'll take any questions.
Thank you. Any questions for the witness? Seeing none. Appreciate your time. Thank you. Make sure you fill out your witness form and then exit the room once you've done that, please. Next in opposition.
Oh, there we go. Good morning, Senators. I'm the Reverend Dr. Molly Hausch-Gordon of Columbia, Missouri. I'm the mother of 2 young children and the pastor of the Unitarian Universalist Church of Columbia. I'm here to speak in opposition to HJR 73. In my role as pastor, I work with many individuals and families amid the deep challenges of their lives. I have walked with those who, with both heartbreak and clarity, have needed to end pregnancies that were dangerous to their health. I have walked with those who did nearly die and had their fertility permanently damaged when they were unable to receive timely treatment for an ectopic pregnancy. And I have walked with those who desperately want to become parents but who were afraid to become pregnant under a dangerous abortion ban that severely diminished their options if anything were to go wrong. I'm here today because my experience and my faith tell me that abortion is a sometimes difficult but always moral choice that the people of Missouri are equipped to make as moral agents formed in the image of the divine. Stripping away people's rights to their own God-given conscience in the face of some of the most intimate and tender decisions of their lives is an affront to our humanity and to God. You may have been told that abortion bans are required by faith, but they are not. The idea that opposing abortion is the only way to be a good Christian or a good person of faith is wrong, and it makes an awesome and loving God very, very small. Polling consistently shows that the majority of people of faith in this country support access to abortion health care in most or all cases. More than 2/3 of Catholics believe this. More than 2/3 of white mainline Protestants believe this. More than 3/4 of black Protestants believe this. Unitarian Universalists, Jews, Hindus, and Buddhists. They believe this from the position of their faith, which calls them to compassion and care for one another. In November, a clear majority of Missourians, many those of faith, voted for one another's welfare to restore access to the full range of reproductive decision-making that we need to thrive, and to affirm the God-given dignity of choice in matters that affect our well-being so deeply. I urge you to respect the will of the voters and champion the welfare of our people by opposing HJR 73. Thank you.
Thank you for your testimony. Any questions for the witness? Senator Hudson?
Thank you, Madam Chair. Thank you for being here. Thank you for your testimony. You spoke quite a bit about your faith, and I appreciate individuals that are willing to speak about their faith, as I'm a man of faith, and I like to speak about mine as well. If I understood what you said correctly, and I may not get this word for word, please correct me if I'm wrong. You described human beings as moral agents made in the image of the divine.
I did.
Is an unborn child made in the image of the divine?
I know that people of faith have widely varied beliefs about when life begins, and that should therefore be a religious question and not a question decided by the government.
Could you tell me, when your faith, as a person of faith, when do you believe life begins? When does an individual become that moral agent made in the image of the divine?
My personal belief is that the person carrying a pregnancy has a deep internal knowledge given to them by God about their relationship to the potential for life that is developing within them, and that is a knowledge that they are able to have through their relationship with God and through their relationship with the beautiful process that's happening in their own body.
So you believe that it could be different stages of pregnancy depending on the mother's decision?
I believe that the beginning of life is a beautiful religious mystery.
Should we not err on the side of caution and respect life in the womb?
I believe we should err on the side of religious people making religious decisions in their own religious context and not mandating those decisions at the government level.
Well, we do have laws at the government level with regard to life and the taking of life.
We are a constitutional democracy that declares a freedom of religion and a separation of church and state. And religious people absolutely should make decisions about their reproductive health and their reproductive choices from their religious perspective. What religious people should not do is impose their religious beliefs upon other people of faith.
Certainly, and we could go back and forth, as I know there are other folks that want to testify, and you and I aren't going to agree on this, but I appreciate you being willing to field my questions and have this conversation with me. Certainly, I would, as an individual of faith, I do not introduce legislation that is, trying to force individuals to subscribe to my faith or to join my church. But when it comes to life, that is something that we have to deal with. We have to be willing to articulate in statute. We have to be willing to protect in law, because as a society, we have to respect that. I mean, it's not merely a religious thing. It is also a legal thing. It's a cultural thing. It's the foundation of who we are.
There are religious beliefs that life begins upon birth. There are religious beliefs that life begins at other times. Making a decision about that as law is enshrining a particular religious belief into the law.
I disagree with that. Thank you for being here. Thank you for the conversation. Thank you, Madam Chair.
Yeah, go ahead, Senator.
Thank you, ma'am, very much for your testimony, for being here today. And I've been a pastor for nearly 4 decades now, too. You and I are going to disagree. And I appreciate that, because we have the right to disagree. But I just want to ask you a question, because you mentioned choice. And you do realize if this were to pass by the legislature, this is going to go back on the ballot for the people to choose whether they want to keep what they have now or they want this new law. You understand that, correct? It's going to be up to the people to vote.
I understand that you are sending this back to people that have already made a clear choice. And my belief about that is that you are blatantly disregarding the expressed will of the voters.
But they're the ones that are going to be able to choose. They can keep what they have now, or they can choose this one. It's not up to us to make that final decision. It's going to be up to the will of the people of the state of Missouri.
Who have already made a decision.
And then we're going to give them another one, because we believe, too, that they were misinformed. And wouldn't you agree, too, especially being a minister, that you want to be able to give people all the information that you possibly have from the scriptures or whatever to make their own informed decision?
I trust the will of the voters who have already voted. I believe trying to take something, I believe that you would like another chance to reestablish the narrative. I believe that the voters have already made a very informed decision. And I believe that it would be, if nothing else, a waste of tax dollars and our electoral processes to try to relitigate something that has already been clearly decided by the voters.
Well, I appreciate your opinion and judging my motive, but my motive is to give all the information to the people and let them make a choice. And
I
that's
hear
it.
you.
So thank you for your testimony. Appreciate it.
Thank you.
Just I have a couple questions. You were talking about the trust of and the will of the voters. So are you not trusting the will of the voters if this goes back on the ballot?
I trust that the voters will express their will no matter what unfolds. And I think that it is an expression of disrespect to the voters that the legislature is trying to send this back. But I think that they will express themselves yet again if you are successful. I
think it's interesting because the people that I talk to are excited about the opportunity to weigh in once again, to add clarifying language potentially if it goes to the vote of the people, they have an opportunity to again weigh in. This is an issue that obviously is very controversial. It's very emotional, and so to be able to say, okay, is this what you meant or is this what you meant? Right? That dialogue did not happen on the Senate floor. Right, where we can hear from our constituents and be able to hash out some of the definitions of what this looks like. So to be able to take it to the vote of the people, I'm grateful that your confidence and trust is in the will of the people, and hopefully that will continue as this moves forward and it goes again to those people that you trust and have confidence in. Secondly, in regards to religious decisions, I'm curious, what issue, we're talking about life at conception, which is in our Constitution. And again, I stated this, in 1980, a Democrat-led majority in this building said life begins at conception. That's in statute. And so I wonder how many more conversations we're going to have in this committee in regards to when is murdering a 2-year-old, is that a religious belief? If that becomes a religious belief, is that something that we're going to be hashing out, what that definition looks like? I mean, when does it end?
No major religion believes in the murder of a living human person who is out in the world after they have been born.
Well, I've got
The major
well,
religious
I've-
disagreements are about when life begins within the womb.
Well, we're talking about religious disagreements. We're also talking about medical disagreements, right?
can't speak to those.
Well, we've referred to those in those committee. Other people, you've heard other testimony of doctors who are debating this issue. I just want to bring up an article in 2012 that is from the Journal of Medicine and Medical Ethics. And there were two ethicists, basically, who controversially argued that after birth abortion could be justified. And
After birth abortion is not a thing. I don't even understand what that is.
I mean, in the Journal of Medicine, that was being debated. So I'm happy to provide. What my question is, you're saying that it's a woman's religious, they can believe that that journey is theirs to determine on their own, but government decides and dictates all the time the value of life. So if we're debating this, life at conception or after, when do we stop? Because we are having that
No
discussion.
religious tradition believes that a child who has been born can be killed.
I'm just
So-
saying, in your religious perspective, you're saying it's a woman's journey and determination.
That's my
on what-
religious belief. That's not
Okay,
everyone's.
Right. And so you are saying that you 100% have confidence that somebody else cannot come in here and say, no, it is my belief that, as this Journal of Medicine is stating, that there are people who do believe that it is okay to take the life of a child. There are some...
I would not consider that a moral or ethical expression of faith.
Okay. Thank you for that clarifying comment. And then, any other questions?
I just like to make a statement. I'm not sure if you've ever heard of honor killings that the Muslims have under Sharia law. You can do a research on that, and you'll find all kinds of articles on that they do kill their daughters for honor killing. So I just
That
wanted
is
to make
extremely racist, and the use of religion to justify fundamentalist extremism happens in every faith tradition and is also morally unacceptable.
Well, not to interrupt, but you just got done saying that there is no major religion that believes in killing after the child is born.
There is no major religion. There is also no major religion that cannot be twisted to the will of men.
And I think that's our point, right? Even with this idea of birth, life, and its value at conception, I think that is the overarching conversation that we're trying to have here, and to take it back to the will of the people to be able to weigh in. So thank you for your testimony. I appreciate it. Any other questions for the witness? Seeing none, thank you.
Thank you.
Next in opposition. We have a half hour left. So how many more do we have out? How many more in the room want to testify? Okay. If there's people in the room that are not going to testify, will you please exit the room so that we can make it available for those who are waiting out in the hall to testify, please? And we'll pause for a minute to give people an opportunity to exit. Thank you. Begin when you're ready. We're going to, sorry, I didn't see you there, so I apologize for that. We're going to begin with you when you're ready.
Good morning. I am the Reverend Dr. Teresa Danley, Missioner for Public Advocacy for the Episcopal Diocese of Missouri. And since my ordination to the priesthood over 20 years ago, I have served as a clergy counselor for Faith Aloud, where our goal is to provide judgment-free and compassionate spiritual care to people in all their decisions regarding pregnancy, parenting, abortion, and adoption. Over 20 years, I have talked with over 1,000 deeply religious women who have had abortions for many reasons, primarily, unfortunately, because there is no culture of life for families in this state or in this country, no mandatory paid family or maternity leave, little affordable or quality childcare, and when we pass earned paid sick leave in the state.
I need to cut you off. I just need you to lower your voice and be respectful to the senators who are here to hear your testimony.
Okay, well, I'm also a preacher.
Appreciate that.
When we passed earned paid sick leave in this state, some of you in this room are trying to undo it, which is a family policy. Often, women fear for their safety and the safety of other children if they continue a pregnancy. Sometimes the health of their fetus is at risk. And over again, I hear these deeply religious women ask, "Can God forgive me? Am I going to hell?" And I try to ground them in that they made the best decision they could, given that there is no culture of life in this state or in this country. I wish there were. And what I want to say to them is this: shame on anyone who told you that God would condemn you for having an abortion. Shame on anyone who made abortion the most terrible sin there is, when there is a total lack of support for safely giving birth or raising children in this country. Shame on anyone who claims that the Bible says anything to condemn abortion or trans children. Shame on anyone who covers up the fact that Christian women in this country had abortions until quickening well into the 19th century, until men took over obstetrics and gynecology from women.
I need to stop you to keep us
Sure.
at the 2-minute limit. Are there any questions for this witness? Senator Lewis.
Good morning.
Morning.
I appreciate you saying you're a pastor. We've got a lot of pastors that, that we serve with, and it's kind of the energy is good after a long night and everything. So appreciate you making sure we're still with you. But I think you just had a couple more things you wanted to point out, so I just wanted to briefly if you could just touch on what you weren't able to.
Anti-abortion laws were the primary weapon to take gynecology and obstetrics away from female midwives in the 19th century. The crooked theology was developed around that with no biblical basis. Jesus never shamed women. Jesus does not shame or condemn anyone who has had an abortion. Abortion must be kept safe and legal, which is what we voted for when we voted for Amendment 3. And in order to get Amendment 3 on the ballot, we worked very hard. We didn't just pass 50% plus one to put something on the ballot.
Okay, thank you for that. And so you're a reverend, and are you a Christian?
I'm a priest in the Episcopal Church, which is the Christian church.
Okay. And I appreciate your button there that says Jesus never shamed a woman. And I think that, we've got a lot of different faiths here. And, I think that we talk about our freedom. And, I think that this bill is about, an individual's, whether their own freedom, whether they have religious beliefs that support or oppose or whatever. So thank you. Thank you for being here.
Thank you. Senator Hudson.
Thank you for being here. Thank you for your testimony. I am a preacher myself, and that preacher voice just comes out sometimes. I know what that's like. And I really love this discussion with regard to faith, and I do think it's definitely relevant with regard to this issue. You held up a Bible, and you referenced scriptures. You didn't necessarily quote, but you referenced what you believe the scriptures have to say about this issue. Would you agree with me that the scriptures teach us that life is precious, sacred? Human beings are made in the image and likeness of Almighty God?
Yes, and I think that we should really take care of everybody and have a culture of life throughout the entire life.
You keep saying this culture of life.
Yeah.
Are you saying that if our culture does not meet the definition of what you would call a culture of life, then it is okay to take innocent life?
No, I'm saying that you cannot expect women to make different choices when they cannot support the children that they have, when they have no time off to recover from cesarean sections, when their partners have to go to work. I lost over 2 liters of blood bearing my third child, and my husband had to go back to work after a week. Okay? So I was caring for 3 children, having lost 2 liters of blood. Do you think that was easy?
No, I don't think that's easy at all.
But
I
we
can't
had no
imagine
choice.
what-
We had no choice.
I cannot.
And we're in a good position.
Imagine what that must have been like to go through, and I wouldn't pretend to imagine that. I certainly.
So that's what I'm saying, is that if you want women to make different choices, and there will still be women who will choose to have abortions, but if you want women, deeply religious women, who have abortions, to make different choices, you need to provide them with childcare, paid sick leave, paid maternity leave.
So you have indicated that even if all of this is, and we could go into, and I'm not going to, we could go into a lot of things the state of Missouri does right now to help individuals and to try to promote a culture of life. But if I'm understanding you correctly, you're saying even if all of these are met, still women are going to choose to have abortions.
Probably.
Do you agree with that? Do you think that should be legal for innocent life to be taken in such a way?
It doesn't matter what I think, because I'm an individual, and I'm also, I'm a clergy person, right?
We are here to.
You are a legislator.
We are here to listen to what you have to think. It absolutely matters what you think.
If I were counseling a parishioner, that would be one thing, but I'm not. I'm testifying about a state law.
But in your testimony, and I appreciate the fact that in your testimony you have spoken about your faith, you've spoken passionately about your faith, and so I am interested in what you think. Where is that line drawn? I mean, I think you agree with me that life is precious, life is sacred, life is a gift from God. Life does, well, maybe you don't agree with me that life deserves protection. I believe that life should be protected under the law. Do you agree or disagree with that?
I agree with Dr. Molly that there are a variety of viewpoints on when life begins according to different people of different faiths. I think you could disagree with that up until the point of quickening, which again has been a very common throughout history use of when life begins.
So the
and if you would let me finish my sentence.
I thought you were finished.
If I were counseling a parishioner in my parish who was trying to decide whether or not to have an elective abortion, most likely I would try to make sure they had all the resources possible so that they were able to bear that child. But somebody who's not religious or who has different beliefs, that's entirely up to them. That's not for me to decide for them.
Appreciate, and thank you for responding to my question and being so willing to do that. The previous witness indicated that there are some belief systems, some faiths that believe life begins at birth. Now let's talk about Missouri law. Do you believe abortion should be legal up to
Yes.
the point of birth?
Not till birth. I mean, who says that?
So you agree we need to draw a line somewhere in law?
But nobody aborts up to birth.
We have just heard testimony that there are individuals that believe that life begins at birth.
But nobody
and we
provides
also
abortions up
have
to birth.
we have also heard testimony that this individual believed that Missouri law should reflect the fact that people have different beliefs about when life begins. So
Sure.
when would you, as you speak to us legislators, the lawmakers here, when would you say that that line should be drawn in law?
Me personally, as a layperson with regards to the law and medicine, let's see, I was born prematurely with cerebral palsy in 1977 at 30 weeks, and now viability is about 24 weeks. So, I mean, really, like the likelihood of anyone really having an abortion, unless there's severe fetal anomalies after 24 weeks, is highly unlikely, right? Because any fetus that doesn't have severe fetal anomalies is probably going to survive with medical technology.
You said 24 weeks?
Most likely.
So that's where you would draw the line?
I mean, in terms of like a humanity.
So
I don't know. I'm a priest. I'm not a medical doctor, but my experience having been born and put in a NICU and knowing about technology now and having born 3 children, I would say that first of all, any woman that I've counseled that has had to deal with an abortion of a child because of fetal anomaly makes that decision very, very seriously and doesn't want to do it. And it is very, very difficult and painful and expensive to access that care. It is not something that is done willy-nilly. It's not something that you can walk into a Planned Parenthood and have done. So I feel like it's always a specious argument to say, oh, people are having these late-term abortions. We heard from one of the proponents of this law that 93% of abortions are before 12 weeks. So, you know, I really feel like focusing on late-term abortion or abortion up to birth is kind of irrelevant.
Well, I would counter that it certainly is relevant based on the testimony that others have given. You mentioned quickening earlier. That can start around 16 weeks, is my understanding.
Sure, for different people.
For different people. Thank you for your testimony. Thank you
You're
for taking
welcome.
my questions.
Senator Nierenberg?
Thank you, Madam Chair. Just a very brief comment. Dozens and dozens of Missourians have traveled here. I believe over 150 Missourians have traveled here to voice their concerns with undoing Amendment 3. And we are going to have ample time, I believe, to discuss this. I'm not going to convince any senator today of my stance of why we need to uphold Amendment 3 and vice versa, quite frankly. And so I really hope that we can use the remainder of our time to hear for those who have come here to share their concerns with this. Just wanted to express that part. And then very, very, very quickly, again, I go back to Amendment 3, and we have it there on page 4. That was the original Amendment 3, and it very clearly states that the General Assembly, the government, can go back and define those things after fetal viability. That was part of Amendment 3, and I push every voter to look at that and read the full language, as voters did, as the Secretary of State's office ensured that there was fair ballot language presented in every single polling location. That information was there, and it was available for folks. So, again, just clarifying that. Thank you.
Yep. Senator.
Thank you, ma'am, for your testimony, and you and I both are ministers, and I just want to make a statement. It's just very interesting to me that when I inject as a minister my position that I believe life begins at conception and abortion is wrong, then I always get attacked by separation of church and state. So I'm just curious to see people on your side. I'd like to hear them say the very same thing about you with separation of church and state, or any other minister that has injected their religious beliefs on the other side of what I believe. So anyway, just wanted to make that statement. Thank you very much.
Thank
Been
you for your
gaslit
testimony.
Missouri for 20 years.
Make sure you leave a witness form. Thank you. Next in opposition. We have 15 more minutes, so we're going to limit testimony now to a minute and try to get through as many people as possible. Make sure the green button is turned on.
Oh, it's on. It's on now. Hi. My name's Jerry Heil. I live in SD7, and in 1977 I had an abortion. My boyfriend and I had been together for 2 years. We were students at the University of Missouri, Kansas City. He was a chemistry major. I was majoring in mathematics. My abortion is what some would call a bad abortion. My life was not in danger. I hadn't been raped or been a victim of incest, and there was no fetal anomaly. I was 20 years old and not ready to be a parent. However, I will tell you what my so-called bad abortion did for me. It allowed me to graduate from college and go on to get my master's degree in special education. It allowed me to have a career of teaching blind and visually impaired students to read, use technology, advocate for themselves, and learn the skills to become successful citizens. It allowed me to eventually marry, and when I was ready and able, to raise a wonderful daughter. And it allowed me to own a home and become financially independent. All of these things become possible for me as I did not become a young single mother with limited job skills.
Thank you for your testimony.
That was it. Vote no on HJR 73.
Thank you. Make sure you grab a witness form, please, and it's filled out and leave it on the table. Any questions for this witness? Seeing none? Thank you. Next in opposition.
Hello. Hi. Make sure we're okay there. Hi, thank you for your time. My name is Sarah Helen Johnson, and I live in Senate District 19. I'm here to oppose HJR 73 because it's a blatant overturn of the will of the people, and it's putting misleading abortion ban ballot language back on the ballot to the people, not specifying the 12 weeks, and adding in transgender care that is misleading because there's no youth transgender surgeries happening in the state. The people knew what they were voting for, and attempts to make this seem less legitimate because it doesn't match the personal beliefs of senators and representatives who were elected is not okay. And this is also wasting taxpayer time and money. I got an abortion for very personal health reasons. I was on birth control, and I have chronic health issues that I don't believe make me fit to be a mother, be a full-time caretaker. Although I do a lot for my community to care for people. My grandmother always said this decision is a choice between a woman, her God, and her doctor, and the government should not be involved in these choices. Sorry. The gentleman from Moberly in a previous hearing, oh, okay, we'll be done there, sorry.
No, I appreciate
And
it.
I have written comment, I can leave as well.
Thank you for
so.
being respectful of the time and
Yes.
the other testimonies that we haven't yet heard.
Are there any questions? Or?
Any questions? Senator Bratton?
Just to clear, you realize that this does go back to the vote of the people, and it'd be their decision. It's not us overturning anything.
Yes.
It'd be the people overturning their decision, right?
My problem is now there's another bill that maybe is going to lessen the Secretary of State's involvement in what that final ballot language is. I'm sure you're aware of that. I forget the number
No,
right
I
now.
don't know what you're
but,
talking about.
okay, well, I can send your staff an email after and clarify that because I don't have it at the top of my head. But I do think the ballot language as it's presented right now is very misleading, and that's how it's presented. And so it's the same argument that you all made for ours. You know, I do think it's valid in this situation as well, especially since it's not specifying the number of weeks at that limitation, which was a really important part of our campaign, that 24 weeks. So I just wanted to clarify that. So
Okay, thank you.
All right, any other questions? Seeing none, appreciate
Okay,
your time.
thank you for your time.
Thank you for leaving the witness form on the table. Next in opposition.
Hello, thank you for your time. My name is Marie Carlson. I'm a resident of Boone County, and I am a volunteer with Abortion Action Missouri. I first became involved in February of 2024 when I heard that there was a meeting for people who wanted to gather signatures on the petition. The very first meeting I went to, we had a group that drove up from Cape Girardeau all the way to Columbia because they wanted to get petitions to take back home to have their friends and family sign. I went to my friends and my coworkers. They wanted to sign. They told their friends. I got calls from people I didn't even know who wanted to meet me so they could sign it. I had some people drive from outside of Boone County to come to Columbia to meet me to sign it. We went door knocking. People answered the door apprehensively as soon as we told them why we were there. They thanked us. People were scared and angry, and they wanted to sign this. We carried copies, full copies of Amendment 3 with us and asked them if they would like to read it. And we had multiple people that told me personally, oh, I have already read it. I had several people.
Thank you for your testimony. Just
oh, sorry.
In
I'm
respect
just-
of the testimony of people who have not had an opportunity yet, we're just trying to keep to our 1 minute time limit. Any question? Sorry. Senator Lewis. Thanks.
Good morning. Thank you for being here. I can tell you're not a professional testifier, so I think your passion and your grassroots advocacy is an example of a lot of the folks in this room, people from my district going door to door, collecting signatures. I think we keep hearing about out-of-state money, but, you know, the folks that I saw are people like you at the grocery store, you know, at the bus stops, you know. So anyway, thank you for being here. I know this is not easy to come at like short notice, so just wanted to thank you for your testimony and your work on behalf of Missourians.
Senator Bratton.
Yeah, so you were circulating the Amendment 3. So did you disclose to people that it would absolve safety standards at abortion clinics to people that were signing it? Because that's what the court overruled. I mean, we can shake our heads, but that's what the court overruled, those standards. That Amendment 3 put a stop to that. So did you disclose that to the people that this amendment would overturn those safety standards?
I did not advise people
What about
on any way on the
what
amendment.
about the fact that it would absolve liability for physicians that carry out abortions and harm women during that procedure? Did you disclose that?
I did not advise people in any way. I offered them a copy of it to read.
Okay, but you were saying that you were disclosing and showing them and telling them really what's in it so they knew what was in it. So did you disclose those measures to them?
If they were in the writing, they had it.
But do you remember yourself telling that to the people signing that that's what this amendment would do?
I don't recall anyone.
No, they didn't ask the question because you're the one giving that information. So did you disclose that that was what was in Amendment 3 to the people signing the petition?
I had copies with me and offered it for them to read it. Most people told me they had already looked it up online and read it. There were a handful of people that told me they had actually already printed out their own copies.
Okay, all right, thank you.
Thank you.
Senator Nurnberg?
Yeah, just a comment for the record. Amendment 3 did not absolve liability. People can still seek remedy for negligence. I'm clarifying that once and for all. It is abundantly clear. Please stop repeating that lie. Amendment 3 did not absolve liability, full stop.
Thank you for your testimony. Next, in opposition, begin when you're ready.
Yes, I'm in opposition. My name is Sarah Jensen. I'm a physician. You might wonder why a dermatologist is here and how this amendment affects me. I've been over 25 years. I've been a colleague of Dr. Haruza in the House. I wish I had more colleagues beside me, but they're busy taking care of the women that everyone's so concerned about here. And they're doing, those doctors, when I experience a problem with my own patient, called it the dark ages when abortion was banned. I'm a rape victim. My daughter's a rape victim. The only other time I've been in this building was to stand in front of the rape kit advocacy team because it takes 2 years to get a rape kit through Missouri, as it is with the Highway Patrol lab. I had an abortion at 19, and if I didn't, I wouldn't be here taking care of Missouri's Medicaid population, which is a very small part of our physician community. I am a physician to a young woman with an undesired pregnancy. She had no options. I didn't know what I could tell her to do. I thought I might be prosecuted if I were to help her in any way. She had the most painful abortion medically at home. And I appreciate you letting me talk.
Thank you. Thank you for your testimony. Any questions for this witness? Make sure you fill out a witness form, please. Senator Lewis?
Yep. Hi there.
Thanks.
Thanks for being here. I just wanted to also kind of bring up something that I keep hearing about, the Amendment 3 got rid of all the safety standards, and what it actually did is just aligned with other outpatient clinics and procedures. So prior to Amendment 3, there was more rigorous laws for clinics and that provided abortion care, and what it did with the court case just aligned it with other clinics. So it just didn't make it it's just apples to apples, whether you're getting an outpatient procedure. So do you know, are you familiar with that?
I don't think there's any safety when abortions are banned. I mean, you can tell that to my 45-year-old female who bled for a month because she couldn't get a DNC because she had miscarried. I was able to get a DNC after I miscarried a day later. She bled for 4 weeks. So there's no way that abortion bans make it safer for women's health. People die. It doesn't get into the news, but they die. And if you know any OB-GYNs in the area, they'll tell you it's a dark age.
Right. Yeah. And I'm just talking about like kind of the actual facility restrictions that we've heard a little bit of a discussion about, that it just post Amendment 3 in the court case, it just aligns abortion clinics with other outpatient clinics versus
same standards.
Yeah. Yes, exactly. Thank you.
Any other questions? Senator Bratton?
So your testimony is that prior to Amendment 3, you didn't have the capability, if a miscarriage occurred, you didn't have the capability to go in and do a DNC?
Prior to Amendment 3, well, yeah, that's what my patient experienced. She wasn't given the option. I actually had two.
But that wasn't according to the law. That was malpractice on the end of a provider that didn't know what they were supposed to be doing.
Providers, excuse me to interrupt. Providers did not know what to do in those dark
ages. The law was clear. It was so abundantly clear.
Our hands were tied. It was so vague. I can tell you that.
It said miscarriages, ectopic. I mean, it was all listed out of what they could do.
I can only tell you what I experienced in my clinic taking care of the patients that you guys are also concerned about. I can only tell you what I see in my clinic, and they are women not giving the opportunity because doctors were too afraid.
Negligence of the law is no excuse. That's been a standard. Just like if the speed limit is 35 out here and I'm doing 50, negligence of the knowledge of that. And when you're a provider and you don't know what the actual law states, and you're actually harming women, and then you want to come here and testify to say that it was the fault of the law when it was the fault of the provider, I think is misleading at best.
I can't speak to someone who compares a woman's uterus to a car or a ticket.
I'm saying negligence of the law is no excuse.
I can't have this conversation with you.
Well, but it's abundantly clear. So I guess that's what I'm stating is it was abundantly clear in law what those exceptions were, which miscarriage clearly gave the capability for any provider to provide the services and render the health care needed in that sort of circumstance. So it wasn't the law's fault. It was the negligence of the provider.
You're not going to put this on me, sir. You're not going to put.
But that was your
You're not
testimony.
going to put this on physicians. We're doing our goddamn best out there. Excuse me, I didn't mean to. I'm sorry. We are doing our best out here, but you guys are not letting us take care of patients in the manner that we need. And I'm visibly upset because you can't take that out of our hands. It's a decision between a woman and her provider. It is not up to you all. It shouldn't be.
It absolutely
And
is.
it's sending doctors out of Missouri. People do not want to do OB-GYN residencies here, and you're losing your physicians. So if you're worried about who's going to do these abortions, I mean, I'd rather have them in a facility, and I'd rather have them with a mid-level or a nurse practitioner, but I definitely don't want them back in their homes or in their backyards or backyard. I don't want any of that happening, and I saw it with my own patients. The medical abortions do not always work. And I don't even know if they worked in the case of my young college student. It's an argument I can't have because it should be a discussion, not an argument in the facility of my practice.
Okay, thank you. Real quick, I wanted to clarify. So this is Section 5 of the actual constitutional amendment. No person shall be penalized, prosecuted, otherwise subjected to an adverse action based on their actual, potential, perceived, or alleged pregnancy outcomes, including but not limited to miscarriage, stillbirth, or abortion, nor any person assisting a person in exercising their right to reproductive freedom with the consent be penalized, prosecuted, or otherwise subjected to adverse action for doing so. So I wanted to clarify that is what the actual constitutional amendment states, that you are absolved from any and all liability if you harm, maim, or kill somebody while carrying out an abortion.
I don't think doctors are ever absolved of any kind of.
That's what the constitutional amendment states,
Right.
ma'am.
We need some attorneys in here, and that's I saw so many.
I don't need an
billboards on the
attorney
way.
to clearly read what
we
the
won't
constitutional
agree, but
amendment
that's
says.
okay. I appreciate you letting me talk, and that's all.
I appreciate the dialogue. Again, I think we're going to, because words have power, don't they? Obviously, we're debating words that have power. And so to clarify some of the language, and the intent of this committee into hearing this bill is to send this back to the people to add clarifying language on what this looks like. So I'm glad that we all agree that that language has power, and that obviously we need more clarifying language so that we all know what the intent of the Constitution and these bills and the impact that they're going to have on people. So, okay, it's fine. You're next. 1 minute, and probably we'll have two more after you is all, and we'll wrap up.
Chairwoman and members of the committee, thank you for the opportunity to speak. My name is Priya, and I'm a physician. I'm here today to speak in support of access to comprehensive reproductive health care, including abortion, because this is fundamentally an issue of patient safety, medical integrity, and personal freedom. Abortion restrictions have led to serious and sometimes tragic consequences. In just the first year post the total abortion ban, in just Missouri alone, 5,825 girls and women were forced to carry and give birth to their rapist's child. Many of these are women that are too young to legally consent to routine medical procedures, yet are compelled to endure high-risk pregnancies. There have also been a 10% increase in infant mortality due to unsurvivable congenital anomalies. Congenital anomalies like anencephaly, where a fetus develops without a brain, or renal agenesis, where a fetus is developing without functional kidneys. These anomalies are uniformly fatal, and families are being denied the ability to make the most compassionate and medically appropriate decision for their child and for themselves. These laws also force women with life-threatening conditions such as advanced heart failure or newly diagnosed cancer to stay pregnant, often delaying or even foregoing treatment. There are women who wanted pregnancies, many of them mothers already, now facing higher risks of dying and leaving their families
Thank you for your
behind.
testimony.
The
And
reality
we need to end right there because in respect of everybody's time who's also had 1 minute. So thank you for your testimony. Any questions for this witness? Seeing none, thank you. Go ahead, ma'am.
My name is My name is Cheryl Barbaro, and I'm a 66-year-old mother and grandmother. I found that I had to have an abortion in 1978. I'm very grateful that it was safe and legal at that time. It's not an easy decision. It was very difficult for me, and I do not regret that decision to this day. It was what was needed at that time. I just think that this bill, I've been a lifelong voter. I registered at age 18, and I always voted. This is my state. This is my constitution. And I researched 3. I voted yes on 3. That's important to me. And Planned Parenthood has been very good to me. They helped me with my abortion. They also saved my life after that by finding some precancerous lesions and sending me to Ellis Fischel for care for my cancer. And I survived that. And I had a daughter who found herself pregnant unexpectedly when she was in her early 20s. She went to Planned Parenthood. They counseled her not to have an abortion.
Thank you for your testimony.
Thank you.
Any questions for this witness? Make sure you fill out a witness form and leave it there on the table before you leave. But any questions for the witness? Okay, thank you.
Thank you.
Okay. This will be the last testimony in opposition.
Hi, my name is Kenya Gums. I live in St. Louis County, and I'm here to represent the majority of Missouri voters who don't want the government trying to practice gynecology. I am not a professional testifier. This is literally the first time I've ever spoken at a hearing. And I just want to be clear that I'm just a regular Missourian. I was not confused by the ballot language. The very first bullet said, do you want to establish a right to make decisions about reproductive health care, including abortion? Women don't need the legislature of Missouri to protect them from their decisions, their own decisions. It's insulting. And all you're doing is pissing them off. I've spoken to many of them, many friends, I also, in the context of sitting through this hearing, have heard so much about religion, and I am not a religious person, and I feel like that needs to be okay. Like, it needs to be okay for me to live here and not believe what you believe and be able to make decisions for myself.
Thank you for your testimony. Any questions for this witness? Seeing none. Thank you. That concludes, we have to end. That concludes the hearing and the testimony in opposition to HJR73. What?
Just remind them about witness forms.
Yeah.
Feel free to turn in witness forms.
Make sure you fill out your witness forms or your written testimony. Leave it on the table. As we said at the beginning of the hearing, you're welcome to leave those on the table. Those will be distributed to members of the committee.
Even if you didn't get a chance to say anything in committee, feel free to leave a witness form. We will get you guys on record. So.
Yep. saying. What? Yep. Blake, can you grab those in a minute? We're going to go exec.
And this is to attach. How do you want me to attach it?
I've got a big old stack and I'll just separate that.
Okay.
Thank you. And it's Marie. Okay, perfect. Thank you. Okay, members of the committee, we are going to, I make a motion that we move into. Just give her a second.
It wasn't working.
And the lemon law was overturned, too, so. We have 5 minutes to be on the Senate floor.
Thank you.
That's what I told her. Don't let her trip on the wires. All right. I make a motion that we move into executive session. Can I get a second? Thank you. I bring HJR 73 to before the body. Can I get a second? HJR 73 is before the body. Is there any discussion? Seeing none, we've had a healthy and elegant dialogue already. Thank you. I move to do pass HJR 73. Can I get a second? Secretary, call the roll.
Senator Bratton.
Aye.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nurnberg. Senator Lewis.
No.
Senator Carter.
Aye.
If you vote 42.
By our vote of 4-2, HJR 73 is due. 73 is it, right?
Yes, that's it.
Is due pass. I'm gonna now make a motion that we adjourn or move out of executive session. Can I get a second? Thank you. Now I make a motion that we adjourn. Can I get a second? Thank you. We are now adjourned.